Hello sir, myself Shukla Rahul Kumar from 3009 group. Today I am going to talk about COPD in India. Sir, we will talk about these content, which is history of COPD in India, current situations, statistics, legislations and laws, policies and programs, prevalence, preventive measures, and conclusion. Sir, history of COPD in India according to the NCMH estimate in 2017, which is around with surveys show that around 17 million people were affected by this disease. COPD prevalence varied at 3% to 8% males and approximately 2.5 to 4.5 percent females were affected by this disease in um, last 5 decades. Sir, according to the Indian Council of Medical Researches in 2004 and to 2006, there are 35,000 urban and rural residents were surveyed in which mostly people were affected with COPD. COPD. Current situation of we will talk about current situation of India of COPD in India. COPD is responsible for the 75.6% of chronic respiratory disease in India. According to the survey of 2016, the number of cases in India is increased till 55.3 million in 2016. It is COPD is the second most death cause of in India after heart disease, in which in 2017 approximately 1 million people per died. We will talk about statistics, and we can see in this graph that the males have more risk uh, to having COPD than females. And when the age is increased, the COPD chance risk mostly increase. And now morbidity in India contribute significantly growing percentage of COPD mortality, which is estimated to amongst highest in the world. That is more than 64.7 estimate is standardized death rate, 100,000 amongst both sexes. This would be translated to the 556,000 in cases of India out of world total of 2748,000 annually. Such as mammoth volume of disease have potential overwhelm health system and state economies. So, according to financial, it is affect financial status of the country. COPD patients and financial resource annually in India spends 32,000 crores on treating the disease as per 2005 report, which is increased in 2019 and 2033 uh, 3,651 crores. It is little less than the allocation of National Education Mission RS 38547 crores. Mm, Legislations and laws. And the India government have declared many laws for prevention of its citizen from COPD. There are some constitutional laws. Is law for smokers. In law for smokers, the Indian government has decided a particular age, which is 18 years. Air pollution prevention act. Main causes of air pollution in India is vehicle and industries and factories, which is can lead COPD. Indian government had passed law to control the emission and pollutants, which is can be cause COPD. Now we will talk about policies and program which is done by the government of India for COPD patients and controlling to the COPD. National Tobacco Control Program launched by Ministry of Health and Family Welfare. Government of India those in 2016 and sorry 2007 and 2008 with objective bring about greater awareness about the harmful effect of tobacco used tobacco control laws under the Quiet Tobacco Program, supported by the Government of India. Mobile technology is being utilized in the integrating name and section program Quiet Tobacco for Life. The aim of this program is the reach out the support of tobacco users of cigarette categories who wants to quit tobacco uses. Prevention and measure. There are some steps which can be prevent it. Primary steps is the before the COPD is start. Primary prevention is COPD requires to reduction of avoidance of personal explore to common risk factors, tobacco smokers and occupational exposures, indoor and outdoor air pollution and irritant to be started during pregnancy and childhood. Secondary and tertiary mm, prevention is secondary and tertiary prevention which involves early detection of COPD case, smoking, pulmonary rehabilitation, and reduction of personal explore and noxious particles and gases can reduce symptoms, improve quality of life, and increase physical fitness. It helps to slow progression of COPD complication. Uses of influenza vaccination and pneumococcal vaccination in COPD case help to decrease in exacerbation. So, according to the PBT, we can say that the India's government done so many steps for their citizens. The mm, the prevent of COPD in consequences is community should be educated about the COPD important of smoking class cessation prohibition of smoking in public places and to ETS exposure. At primary care level, identifying current smokers early and intensive individually level to refrain them and from smoking necessities. The social economic burden of COPD far outweighed to the cost of active cases finding through spirometric assessment of risk smokers primary care's health and health can be maximized to by training physician in the management of health. The CO and the government of India is doing some laws for the stopping the smoking and to stop the uh, this disease. Thank you for attention. This is the reference which is used in for the get information.